Well, welcome everyone to our webinar on an introduction to mast cell activation syndrome. It's my absolute pleasure to introduce Deborah Bircham. She is the Community Support Coordinator at Mast Cell Action, and she's very kindly given up her time today to give an introduction to mast cell activation syndrome and really cover, I've seen the slides and they look so informative and so interesting, and hopefully we'll just give people a really good overview of a bit more information on that topic and food for thought. The session is going to be about an hour. There'll be about 40 minutes on slides and talking, and then there'll be an opportunity to ask questions. It would be really, really helpful if you could put your questions throughout into the Q&A box rather than the chat box, because they might get lost if they go into the chat box. So please try and pop them into the Q&A box. Oh, it's saying I think the chat. Oh, somebody popped something in and said I think the chat's disabled. So apologies for that. I'm not having a very good tech day today. I'm on my phone and my laptop. So yeah, if you can pop any of your questions into the Q&A box, I will try and enable the chat once I've handed over to Deborah. And I'll send a message on there if it's available. And yeah, there'll be 20 minutes for questions at the end. Anything we don't cover, we will try and pick up afterwards. It is being recorded and it will be added to our YouTube channel within the next couple of days. And you'll get an email if you registered for the webinar, letting you know when that's been sent out. So without further ado, I will hand over to Deborah, and I'm going to turn my camera off, but I'm here, and if you need anything at all, I'm very much here, and just give me a shout. So thanks everyone, and I hope it's a great session. Thanks, Deborah.
Lovely. Thank you so much, Jo. It's lovely to be here. So I'm going to share my screen. There we go. Just make sure that everybody can see that. Can you just let me know if you can see that, Jo?
Yeah, I can see that. That's perfect.
Beautiful. Lovely. Okay, so yes, I'm going to be introducing the topic of mast cell activation syndrome to you and telling you a bit more about what it is, and also a little bit about how it can overlap and correlate with POTS. So as Jo said, this is me. I'm the Community Support Coordinator for Mast Cell Action. I have not POTS, but a different form of dysautonomia. I have MCAS and I have Lyme disease. And that's my email there if you want to get in touch with me. So the beginning really here is to just explain that there is a correlation between MCAS and POTS and also hypermobility syndromes, as I'm sure many of you know. And the studies suggest a conservative estimate is around 30% of people with POTS also have features of MCAS. However, more recent studies are starting to show that that number might actually be even more, for example, potentially 60% or even more. So there is this correlation, and you can see here, I'm sharing this diagram that was published by Dr. Kucherak and Dr. Chang in their paper, and they've tried here, and it's so difficult to tease out which symptoms are caused by POTS, which by hypermobility syndromes, which by MCAS, but they've had a go here at trying to separate them out, and you can see there that there are areas of overlap. So particularly shared features, chest pain, fatigue, cardiac issues, palpitations, hypertension, gut symptoms, headaches, they are all kind of the areas where these conditions all overlap. And then with POTS, obviously, we have that lightheadedness, blurry vision, issues with the autonomic nervous system, and with MCAS, lots of allergic type symptoms. So there's this big correlation, and I'm hoping that by sharing this with you today, you might be able to see a bit more or understand that a little bit more, because it is a little bit complicated to pick out. So what is MCAS? It's an immune disorder, basically, and our mast cells in our body are activated by triggers that they shouldn't be activated by, such as foods or things in our environment. The symptoms affect multiple parts of the body. It can start suddenly, or it can gradually get worse over time. And you might think, oh, I used to just be a bit sensitive to things, and now I'm really struggling. Some people are born with it, and they're really poorly from birth. And I'm going to talk a little bit about the treatment as well, a combination of self-management and medication, because really with MCAS, it's unlikely that you'll find a magic bullet drug or medication that's going to fix MCAS and all your symptoms. So with MCAS, there's a kind of double management. We need to do some things ourselves and also find the right medication. So I'm going to be explaining each of these areas in a little more detail. So mast cells, they're a type of white blood cell. They're part of the immune system and they're found in all parts of the body, which is why the symptoms are systemic because they're in our eyes, they're in our brain, in our heart, in the linings of our mouth and our genitourinary system and our bowel and our gut, our skin, everywhere. And they detect incoming dangers, incoming triggers, and release chemicals known as cytokines, which are messengers that tell other immune cells what to do. So they're often referred to as the police officers because they're like the first line of defense and they're like, oh, hello, guys, I think we've got some trouble here. And they spot things and they start releasing their cytokines. So the things that should trigger mast cells are things like bacterial and viral infections, parasites, if we've been stung by an insect, that angry red, itchy feeling, that's your mast cells getting active. Or if we have wounds, they're part of our wound healing mechanism. So that's what mast cells should be doing. But for people with MCAS, the mast cells become hyperactivated and hypervigilant, and they start reacting to things in our environment that wouldn't normally be bothersome and foods that should be perfectly safe for us to eat.
Deborah, can I just interrupt? Sorry. There's a
Yeah.
couple of people who've said that they can't see the whole of the diagram as there is a box covering it. And there is, you're kind of hovering over it now, but
Ah,
it's because of
yes.
the, fantastic. I
Have
see.
I minimized it? Okay, sorry about
Yeah,
that. I
it's,
don't know why it does that.
there are still some sort of now the grey boxes are sort of covering the kind of top banner where it says mast cell action and there's some wording that I can't see that's in
See,
orange.
that's my Zoom panel and I can't get rid of it. I don't know
Okay, well
how
that
to,
I think
it's my toolbar. So if I put it right, see if I put it at the bottom, it's covering.
it's
Oh, if
better
I
that it
put it
covers the top.
there, is that
Yeah, so
better?
yeah, I think that's going to work better, and then we can just keep an eye on it per slide. But I think we can see everything in the slide now. So
Oh, I'm so sorry. I don't know why it does that. It's the Zoom toolbar, and for some reason it's appearing over the top of my slides.
no, not
Oh.
that's we can see everything there now. So thank you for that. Sorry to interrupt you.
No, please do. Yes, keep shouting if there's a problem.
Thank you.
So, thinking about the difference now between allergies and MCAS. So IgE mediated activation of mast cells. So that's how mast cells are supposed to be activated. It's a classic allergy response. Mast cells get triggered by an allergen that binds to that immunoglobulin antibody on the surface and triggers them to degranulate, to release all of their chemicals, and it's immediate, it's predictable, and it's linked to a specific allergen. So you're allergic to peanuts, you're producing antibodies against peanuts. Every time you eat a peanut, you react to it. You only react to peanuts. That's a classic IgE mediated allergy. The difference with MCAS, mast cell activation syndrome, is that it's what's known as idiopathic, which means there's no known cause. And in MCAS, the mast cells release their chemicals without an antibody trigger. So it's a non-IgE mediated response. And it can be spontaneous, just happening all on its own, or it can be in response to some stimuli that shouldn't be problematic. As I said, like changes in temperature, pressure on the surface of the skin, stress, foods, chemicals in the environment, toiletries, things that would normally be safe. The mast cells react without any warning and without any obvious cause. And this is why it's not always predictable. So some days somebody with MCAS might be able to eat a peanut, and another day they might not be able to, but another day they might be reacting to their shower gel. It's very unpredictable in the way that traditional allergies are not. They're very specific and predictable. So and also there's multiple triggers. So it's not just one thing that you're just allergic to one or two things. There can be many, many different triggers with MCAS. So the symptoms of MCAS are many, many symptoms can be potentially caused by MCAS. And generally speaking, they affect lots of different body parts. For a diagnosis, they must affect at least two different systems in the body. So if you only have skin issues, then you may just have dermatitis or psoriasis, eczema, something like that. But if you've got skin issues and heart issues and bladder issues and joint pain, then it looking more likely that you've got mast cells activating in multiple body systems, and that's quite classic for MCAS. No two people experience the same set of symptoms. So some people will get headaches and joint pain, other people will get urinary issues and digestive issues, and maybe they might also experience hives and, skin issues. But somebody else would have, constipation and respiratory problems. So it's a very uneven presentation. It can be, people can have a combination of any or all of these symptoms. Some people just have one or two or three of these. Other people experience nearly all of these symptoms regularly or repeatedly. And the symptoms can change over time, they can fluctuate. Sometimes people are very poorly with it and they're having all of these symptoms. And then, particularly if they get on the right medications or they manage to control their environment, it might go down and they might have less symptoms. But then, if they get a bacterial infection or a virus, they catch COVID, for example, then it can trigger even more, and people can then go back to experiencing, many more symptoms than they've ever had before. So this diagram doesn't cover all the symptoms, but a lot of them are on there, and you can see it. It's on our website. So if you want to get that up on your computer and have a better look at it, it's on the website. So some common symptoms that people generally tend to experience across the board. So in our surveys that we've done, 8 out of 10 people with MCAS have fatigue, chemical intolerances or sensitivities, and also problems with medications and drugs, multiple food intolerances, brain fog, and gastrointestinal problems, tummy pain, things like that, very common. 7 out of 10 people get flushing, redness in their skin, muscle pain and stiffness and joint pain, reactions to environmental triggers like hay fever, itching is a really common symptom, and also abdominal bloating. And then you can see here 6 out of 10 people get fluctuating blood pressure, which, as you can see, there's a little bit of overlap there with POTS potentially, nasal congestion and itching in their sinuses, feeling lightheaded and fainting. Again, is it MCAS? Is it POTS? And diarrhea, again, that gastrointestinal problem picking up there again. So anaphylaxis. Some people with MCAS experience anaphylaxis as part of their reactions, and some people don't. It's a common misunderstanding that you have to have anaphylaxis in order to be diagnosed with MCAS or to have MCAS, and that's not the case. A lot of people with MCAS have reactions, but they're not anaphylactic. And some people don't start off as being anaphylactic, but then maybe they become anaphylactic. So anaphylaxis is a very serious allergic reaction, very rapid onset, multiple body systems, and it can be very mild. You can be in anaphylaxis and not, it not be life-threatening, but you can just be very poorly with it, or it can potentially be life-threatening. And that's because of the mast cells in the throat. And if they start to be affected and they begin to swell, it then can prevent us from being able to breathe and can compromise the airway. So people have a persistent cough when they go into anaphylaxis, potentially swollen tongue, swollen lips, the feeling of swelling in their mouth. Maybe they start to have difficulty swallowing. Breathing becomes difficult, wheezing, abdominal cramps and pain, vomiting, incontinence, or loss of bladder or bowel control. And sometimes, quite often, the blood pressure will plummet very suddenly, and they might feel confused, they might collapse. A symptom that a lot of people report is what they describe as an impending sense of doom. So they feel this overwhelming emotional response of terror, if you like. That can be mild or it can be, as I say, very severe, but that is a typical anaphylactic presentation. And people often get that in response to food and drinks, to medications, particularly if they get stung by an insect, but also environmental triggers like breathing in perfumes and airborne particulates. So I've talked a little bit about mast cell mediators. So the mast cell contains these chemicals that they release in response to those triggers, and they are the mast cell mediators. And those mast cell mediators are stored in what are known as granules inside the mast cell, and they're there as a store, prepared, primed, ready to go at a moment's notice. And there are hundreds of different mediators that mast cells can release. The best known one is probably histamine. Everybody's heard of histamine because it's what gives you an itchy nose in the spring and summer. But also tryptase is one that a lot of doctors have heard of. They're the two that are most commonly known, and people with MCAS quite often have a lot of trouble with histamine. But there are potentially, well, at the moment, 390 mediators have been recorded in research so far, but that number is constantly going up. Some people estimate it might even be as many as 1,000 different chemical mediators that mast cells release. And these mediators are the messengers that get sent out into the body to tell the body to do different things. And some of these mediators are released instantly. As I said, they're there, stored, ready to go. Histamine is an instantaneous release one. Leukotriene's released within about 15 minutes, but some of the mediators, some of them are called cytokines, and it can take many hours for those to be released. Some are delayed by maybe a day, as much as 24, maybe even 48 hours. So then it becomes quite tricky to see what you're reacting to if it's a delayed response. But these are some pictures here. You can see the resting mast cell there with all its little granules. You can just about make out on the surface these little pockets. And then the next picture is where it's been activated. This is what we call degranulation, or what it has degranulated, which means the granules in it have burst and it's released all of its mediators. And there you can see that picture there is showing how the mast cells look when they're degranulating and they're releasing their chemicals. So people with MCAS often talk about the histamine bucket theory, and this relates specifically to the mediator histamine, and we often have too much histamine. It's a big problem for people with MCAS that we live with too much histamine because our mast cells are releasing it too much. And we think of the body as an empty bucket in this analogy, and everything that we're exposed to triggers our mast cells to produce histamine, and gradually that bucket fills up and fills up. And if we can empty that bucket and keep our exposures low and the amount of histamine low, then we can get away with not too many symptoms or maybe no symptoms. But everything that we come into contact with fills our bucket. And when we've had too much in the bucket overflows and then we get symptoms. And this is why it's so unpredictable, because if you have an exposure to, say, for example, tomatoes, you might be able to eat tomatoes when your bucket is quite low. If you've not been exposed to anything else that day that's a problem for you, you might get away with a tomato. If on another day you've been exposed to somebody's perfume and the weather pressure has changed and maybe your hormones are different that day and you've eaten some other food that maybe, is high in histamine, then you eat a tomato, then your bucket overflows and you think, well, I'm reacting to a tomato and the other day I could eat it fine. This is how the histamine bucket works with MCAS. So I've mentioned some of the triggers and the ones that, are normal, like insect bites and infections, but with MCAS, we can also react to fragrance, pollen, caffeine, and alcohol are big triggers of mast cells, stress, temperature changes. Some people react to too much heat, some people react to cold, some people it's just the change. They're all right as long as it stays the same, but if there's a sudden change in temperature, their mast cells kick off. Hormones affect our mast cells, particularly ladies. Estrogen is very highly related to histamine. So if our estrogen levels are high, our histamine levels will be high too. So at different points in the menstrual cycle, our bucket may fill up quicker than others. Medications can trigger us, foods can trigger us, and chemicals can trigger us. I don't know what's happened to the S's on my slide. I've tried all morning to fix that, but it won't change. So apologies. And this one. The text is on top, so I apologize. So there are what we call comorbid conditions. So people with MCAS tend to either have been diagnosed with other conditions, which may not actually be those conditions. It may be that they've got MCAS, but they've been misdiagnosed, or they may have a multitude of other conditions because the mast cells have so many different functions in our bodies. Those mediators do so many things, and research is still catching up as to exactly what those chemicals are doing. We don't even know what half of them are yet, and we don't know what they do in the body, all of them. So, for example, there's a correlation we can see between MCAS and type 2 diabetes and, blood sugar regulation issues. We don't really know why that is yet, but we can see that there is. And this is where dysautonomias and postural orthostatic tachycardia syndrome, POTS, comes into the picture because there is a correlation here, particularly between MCAS and dysautonomia and hypermobility syndromes. That is often called the trifecta with MCAS specialists. They see people with those three conditions very often. But fibromyalgia, Kunis syndrome is a condition of the heart where allergies can cause the heart muscles to go into spasm. It's very rare, but it does happen. People also get PTSD and neurological and traumatic correlation because of the effect of the mast cells and the nervous system, which I'm going to talk about. PANS PANDAS is also, autonomic, sorry, autoimmune neuropsychiatric disorders of the immune system attacking the brain. Basically, that is very common overlap with MCAS. Neurodiversity, there's a lot of research now that shows these chemical mediators, they affect our brain and our brain development, and there's very high correlation between autism and ADHD and people with MCAS. And again, the research is still in its infancy there. The digestive system, you can see already that digestive problems are very common in MCAS, and it's because our gut is lined with mast cells, and our gut is very affected by whatever the mast cells are doing, and so people often get irritable bowel syndrome, Crohn's disease, celiac disease, any of those inflammatory bowel conditions can be triggered by MCAS or comorbid with MCAS. People experience diarrhea sometimes, other people get constipation, some people have gastroparesis, a lot of digestive issues, but also genitourinary issues, interstitial Interstitial cystitis is a common overlapping condition because the bladder is lined with mast cells. So if they're pumping out inflammation into the bladder, people get what they think is cystitis and bladder pain. So people often have more than one condition. And as I said, it's very unclear yet in the research exactly what's causing what and what exactly the overlap is. But you can see there as well long COVID, very associated, multiple chemical sensitivity, ME, chronic fatigue, and also Lyme disease is often seen in people with MCAS. So there's an interaction here between MCAS and POTS. And some of the ways in which having MCAS can impact on POTS. So histamine and prostaglandins, which is another one of those mediator chemicals, they cause vasodilation. They cause our blood vessels to dilate, which lowers our blood pressure. It can lead to more kind of blood pooling. It stops us from being able to pump the blood and keep it where we need it. So we get worsened orthostatic intolerance. Some of the mediators increase our heart rate and cause palpitations. Some cause unstable blood pressure, but MCAS can be linked to bradycardia as well as tachycardia. So you might have a slow heart rate or a fast heart rate or both at different times. So again, you can see there's quite a correlation and an impact. If you've also got POTS, that's going to upset your POTS when you're having an MCAS reaction. Mediators also increase the sensitivity of our autonomic nervous system. So they stimulate our nerves and our nervous system and cause neurological dysregulation, particularly of the autonomic nervous system. So some people, for me, for example, when I have an MCAS reaction, it's what triggers my dysautonomia because those mediators dysregulate my autonomic nervous system. And that, for me, is what's causing the dysautonomia. Other people, it's the other way round, and they have POTS, for example, and then it's just made worse when the MCAS is, releasing mediators because of that effect on our nervous system. The gut issue there, the mediators affect the gut and cause a lot of times nausea, vomiting, diarrhea, which then leads to dehydration and loss of fluids and loss of electrolytes. And that then affects our ability to maintain our blood pressure, which again will affect us if we live with POTS. So the nervous system and the mast cells are very closely integrated. The neurons and mast cells are right next to each other. So you can imagine when the mast cells degranulate and start pumping out all these chemicals, it's our nervous system that takes the hit quite often. And those chemicals, like histamine, are neurotoxic in high levels. They stimulate the nervous system, they overstimulate the nervous system. So we feel jittery, we feel anxious, we get that impending sense of doom. That's what that's all about. We get pain and sensitization of the nerves so that things are more painful than they should be when we've got too much histamine and too many mediators, and sensory hypersensitivity, so sounds and sensations and tastes and textures feel overwhelming because our nervous system is under attack from all of this intense irritation from these inflammatory mediators. It doesn't have any room for any more input. So if we feel overwhelmed, and then hyperandronergic state. So some people with POTS experience too much adrenaline or too much sensitivity to adrenaline, and histamine release stimulates adrenaline release because adrenaline is the antidote to histamine. It's why we have EpiPens. If we have an anaphylaxis, we get given adrenaline because it blocks the effect. And our bodies are so clever. We're producing too much histamine. So the body thinks, oh, we've got too much histamine. Let's release some adrenaline because that will calm it down. But of course, if you're sensitive to adrenaline or you've already got too much adrenaline, that then worsens your POTS and your dysautonomia. You get worsened tachycardia, worsened blood pressure instability, and all of the rest of it. So you can see there's a complex interaction there between MCAS and POTS. I've just popped this in here because I know many of you will potentially have become poorly since COVID. That's really common for people I know with dysautonomias and with MCAS. And there is now being identified in the research that there's a big overlap between long COVID and MCAS. And the symptoms are quite often the same. MCAS, POTS, long COVID, there's huge overlaps there. And we're finding that people who have long COVID, when they're given mast cell stabilizing medications, antihistamines that block the mast cell mediators, that can help them and their symptoms improve. So there's a correlation there. We know that mast cells are definitely activated by the SARS-CoV-2 virus. That is part of its natural instinct to want to react to viral infections. And we then research is suggesting that mast cells might be part of the picture in what's driving this ongoing inflammation that people sometimes experience after they've had COVID-19. So the research now is suggesting that if people have ongoing gut issues, respiratory issues, and skin issues that are allergic or inflammatory in nature after they've had COVID, then doctors should be assessing them as to whether treatment for MCAS might actually help them. So is it MCAS or POTS? It's really hard to tell, but in addition to your POTS symptoms, you might get flushing, itching, hives, swelling. You might find that you're short of breath and you have respiratory issues that don't seem to be related to your POTS. You might get tachycardia spikes. Your heart rate might suddenly go up or change in a way that's not to do with your posture. You haven't changed your posture. It might be that it happens after eating, for example, or after you've been exposed to some environmental thing like a smell. Your heart rate might go up, and you think, well, I haven't changed my position, I haven't stood up. What's happening? You might be getting gut issues, which might be correlated to foods potentially again, or not just foods, but respiratory inhaled triggers can also affect our gut and trigger the mast cells. Temperature intolerance and sweating after eating, or again after exposures. Sensory disturbances again, that feeling of impending doom and changes in your mood, which come and go. You're not an anxious person, you don't have anxiety all the time, but suddenly out of nowhere, you suddenly think, oh, I feel terribly anxious. And then it suddenly goes away again. That could be a reaction to something. Bladder issues, pain in your bladder or pain on urinating, cystitis like symptoms. Some people get diagnosed with recurrent UTIs, but actually it's their mast cells causing bladder irritation. You might be getting brain fog and confusion. Insomnia is a big problem for people with MCAS because histamine is a chemical that wakes us up. It causes neurostimulation, stimulates our nervous system, stimulates the brain. So when we're trying to sleep, if we've got too much histamine, insomnia can be a really big problem, as well as head pain and migraines for the same reason, too much histamine in the brain. You might find that you're reacting or sensitive to chemicals or medicines. Drugs make you poorly, foods make you poorly. And all of these symptoms suddenly come on, as I say, without warning, and they're not related to posture in any way, and they're not really explained by POTS. It might then be worth considering whether you might have an MCAS picture. And this is so important to consider because for me, as I said, my dysautonomia is very much connected to my MCAS reactions. Now my MCAS is much better controlled. I don't have the dysautonomia unless I'm triggered by something unexpectedly. I very rarely get a dysautonomia attack. So it's really worth exploring this because it might be that if you were to address the MCAS side of the picture, your symptoms might improve. It might improve the dysautonomia, and it might also be that some of your symptoms are not down to dysautonomia on its own. It might be that some of them are MCAS symptoms, and you could maybe improve those and improve your quality of life. So it's worth exploring. So I've touched on there the fact that we can manage MCAS, and how do we do that? I said at the beginning that it's a two-pronged attack, really. we can't do it just with medications. It's rare for someone to just pop an antihistamine and feel marvelous. We need to be looking at self-management. So we need to control our environment a little bit. So we're not exposed to the foods that trigger us. We're not exposed to the fragrances and chemicals, the stress. We need to be able to have tools that help us to manage stress. We can't avoid it, obviously, but we can help ourselves to manage it so it's not so much of a trigger. Temperature changes, exercise, all of these things that are within our control that we can do something about. We can maybe learn our triggers and work out what works for our body to be able to manage our MCAS. And then the other side of it is obviously getting some medical support and using some medications to help us with that. And I'm going to explore a little bit more of that now. So we have a symptom log on our website. It's free to download. If you go to our website and search for symptom log, it will bring it up. And it's a really good idea to do this, to keep a diary. It's the only way really to work out what your triggers are, is to be really, really thorough. And some people say, oh, I've done that. I've written down what I ate. It's not just about what you eat. It's everything. And it's really, a bit of arduous to begin with, but you only need to do it for a short period of time. But the more meticulous you can be about writing down everything that you're exposed to, your friend's perfume, the rooms that you've been in, different places that you've gone, the car. Have you been in the car today? What have you eaten? What chemicals have you used? Have you used toothpaste? Have you used shower gel? What have you been exposed to? Did you go for a walk? Did you do some other sort of activity? Was there a sudden change in temperature? Is today a very hot day? Are you on your period? Where are you in your cycle? All of those things, if you keep a really detailed list of that and then notice your symptoms, you may then start to see a pattern. And as I said, remember, some of those reactions can be delayed. So you may not see the reaction until the day or 2 days after, but you can start to see every time you do this, 2 days later, you're poorly. There's a correlation there. So it takes a little bit of patience and a little bit of consistency and persistence to fill in these logs, but it helps you because at the end of that, you should have an idea of what your triggers are. And that's really the only way that you can start to then manage your environment. So, in terms of dietary self management, food contains histamine. All food contains histamine. And when we eat, our digestive system releases histamine. So that all adds to our histamine bucket. But some foods are very high in histamine, and some foods are very low in histamine. So, generally speaking, reducing your high histamine foods and focusing primarily on eating some lower histamine foods can help you to manage your histamine bucket. Now, we always say it's really important to get some good advice from an MCAS aware dietitian or a nutritional therapist in order to do this, because some people put themselves on massively restricted diets, and that doesn't help either because nutrient deficiency makes MCAS worse too. So you don't want to be cutting out foods unnecessarily. You don't want to be cutting out huge numbers of foods. But you can just reduce the amounts of the high histamine foods and see if you can eat more of the low histamine foods and notice whether that makes a difference to your symptoms. And maybe you can eat a low histamine diet for a week. Just as a trial, there's plenty of low histamine foods you can eat like that for a week and just see how it affects you. That gives you some good information about whether it's MCAS, whether it's histamine that's your issue, but don't stay on that very restricted diet long term without some nutritional advice. We have just published a new resource called Nourishing Health and Happiness, and that's now downloadable from our website. So go on there. Chloe Hall, the amazing dietitian, has helped us to write that, and there's lots of advice in there about managing your diet with MCAS. It's not a one size fits all approach, and it's not always histamine that's the problem. You know, people go down this rabbit hole sometimes of, oh, I've got to cut out all histamine. And there are other things that people can be reacting to. It might not be histamine. Sometimes it's dairy, sometimes it's gluten. Salicylates, oxalates are other things that people react to in foods. Some people find that sugar makes their MCAS worse. But what you don't want to do is cut all of those things out all at once, all at the same time, because then you won't be getting enough nutrients, and that's dangerous. So please don't, be really restrictive with your diet without some good advice. These are just some of the high histamine foods. So alcohols, anything aged, generally speaking. So anything that's old, like cheese or salamis or hams, aged meats, they are all going to be very high in histamine. Leftover foods, this is where you can eat something fresh one day, you get the leftovers out of the fridge the day after, and you're really poorly, and you think, why? Because histamine increases the longer food is kept standing about. So you will react to anything that's old, that's not fresh. Fermented foods is another one. Strawberries are very high in histamine, tomatoes, avocados, bananas. Citrus fruits like oranges and lemons are histamine liberators, so they encourage the body to release histamine. Chocolate is another one that some people struggle with, and nuts. As I said, it's not the same for everybody, so don't just wipe these out of your diet without testing. This is where the food diary really comes in. But you might find that it would be an easy win that if you reduce the amount of cheese in your diet, for example, you might find that things improve. Young cheeses like mozzarella are much better. They're lower in histamine, so you can maybe have some of that instead. What I said there, soy sauce, obviously fermented, yeast, vinegars, they're all very high histamine because they're aged, not fresh. So food is one aspect, and then there's the environment. So the triggers are cleaning products, fragrances, particularly in cleaning products and in toiletries, massively problematic for a lot of people. Pollen is an issue, mold is a big issue for people with MCAS, and we're going to be doing some work on that next year, potentially a resource on mold, but it often triggers mast cells and hypersensitizes our mast cells. So if you've got issues with mold, it's really important to avoid mold. Pesticides in foods for some people can be a trigger. Medications, not necessarily the drug itself, but the excipients, the fillers, the colorings, the things they make the tablets with, they can be problematic. As I said, our hormones affect us. If we're stung by or bitten by an insect, our emotions, people are okay and they're managing okay, and then something really stressful happens and it triggers a reaction, changes in temperature and atmospheric pressure, as I say, all environmental triggers. So some of the easy wins that you can do to help yourself: go fragrance free. Just get rid of that. They're chemicals that we don't need. They have all sorts of undesirable effects on our bodies for everybody. So look for fragrance free and make some swaps. Look for fragrance free cleaning products and toiletries. Generally speaking, the eco-friendly ones are better for us. So we don't like those harsh chemicals because they're what the mast cells are reacting to quite often. So look for more environmentally friendly products that have less ingredients, more natural ingredients. They tend to be better. It's not a one size fits all. You may still react to them, but it's worth exploring whether changing your products. Using an app like the Yucca app can help. You can scan your toiletries and it will tell you how toxic it is. So natural cleaning products, natural toiletries, unfragranced air purifiers can help you really to get rid of those molds and dusts. So have one. I've got one running next to me here in my room all the time, keeping your air as clean as possible, and your water as well, just getting rid of any contaminants. Having a good quality water filter can help to just lower that burden on the mast cells so they're not attacked constantly daily by everything around you. Just cleaning up your environment, making it as pure as possible, getting rid of these things like mold and dust and pollen in your environment. Plastics, a lot of people react to plastics. Think about avoiding cooking in plastic. Don't shove a packet in the microwave, heat it up in the plastic pot, because those chemicals will leach into your food and your mast cells may not like that very much. So think about using avoiding non-stick pans as well, because they have a lot of chemicals in. So ceramics and glass are really good things to use in your kitchen, and avoiding those plastics. And also they give off VOCs, volatile organic compounds, furniture, new furniture, laminates, glues, paints. They all give off nasty chemicals that our mast cells can be sensitive to. And again, we've got a resource on our website, Managing Your Environment, with more information. So how is MCAS diagnosed? Oh, I need to hurry up.
Oh,
So there's a four-part process. So you have to have symptoms that affect two different body systems, as we said. And a lot of people do a trial and find that their symptoms improve with an MCAS medication, like a mast cell stabilizer or an antihistamine. You can test, but it's only available privately in this country at the moment, and it's very expensive and it is quite unreliable. It's quite hard to get a positive test. So a lot of people, a lot of specialists don't do the testing. They just diagnose based on symptoms and whether you improve with the medications. And obviously you have to exclude other diagnoses, because there's a lot of overlap with mastocytosis, which can be, a problematic overgrowth of mast cells. So you want to make sure you haven't got that. So a doctor would need to test for that first. So tryptase is not a reliable marker. A lot of doctors will say, oh, we'll test for tryptase, but that can be normal in people with MCAS. Allergy tests are negative in people with MCAS because they are, as I said at the beginning, they're not reacting to antibodies. They're not producing antibodies, and they're antibody tests. So it won't show up an MCAS reaction. You can still have allergies, but it won't show up MCAS reactions. The tests are things like a 24-hour methylhistamine collection, urinary methylhistamine and prostaglandin collection. As I said, they are not 100% reliable, and again, you can't rule out MCAS if they're not elevated. You can have biopsies. Some people get biopsies or when they're having a colonoscopy, for example, and they can stain them to see whether or not you've got abnormal mast cell activity. There's no genetic test at the moment, but there is research happening to see if people can find a genetic marker. So the collection, the 24-hour collection, is quite complex. It has to be kept refrigerated. There's only one place in the country that does it, which is Sheffield. Has to be transported to them, kept cold. This is why it's very complicated, and most doctors don't have access to that. We do have a leaflet about testing again on our website. You can download that. You can take it to your medical professional to discuss with them, but it's tricky. So if you suspect you have MCAS, keep that symptom tracker and start to notice your patterns. Record your symptoms, photograph things. If it's visible, if you're getting rashes or, other things that are happening, keep photos and videos. If your symptoms worsen after you eat high histamine foods, just monitor your diary and notice that. Consider reducing those histamine foods and see what effect it has. Consider cleaning up your environment, getting rid of any fragranced products and chemical things. You might want to discuss it with your GP. Take your tracker with you. We've got a resource on our website for healthcare professionals that can help them to help you. So you can download that and take it with them. It's called the Primary Care Resource, and they might consider a referral to an allergy centre for you, but it is quite tricky to get a referral. So you can email the charity info@mastcellaction.org, and they can help you to steer you to a specialist who might help you. So briefly, Mast Cell Action was founded in 2015 by 3 people who were affected by MCAS to offer support to the mast cell community, their families, and doctors and researchers. We work with everyone to try and push forward knowledge and understanding of MCAS, and we're the only UK charity that supports people with MCAS. And most of us have MCAS or have a family member with MCAS. Joy is our amazing CEO. You might see her on our YouTube channel. She does an incredible job for the charity. She has two children with MCAS and MCAS herself. I don't know how she does it all. So we have a Facebook support group. We've got our social media platforms and a YouTube channel. We do a community support session on Thursday evenings. We have lots of virtual sessions and online resources that you can download. We run groups. Casper is for children with MCAS, so we have a storybook for children, and we have a peer support and parent support services where you can be matched with someone who can support you. And as I said, our website is full of resources, so please explore, have a look, and download all our resources. They're all free. So these are our contact details. It's mastcellaction.org generally. info@mastcellaction.org is our general inbox. My lovely colleague Denise will get back to you, or you can email me directly at deborah@mastcellaction.org, and follow us on Facebook and all of the rest of it. And that is the end. Thank you so much for listening. I hope that's been helpful, useful, interesting, and I hope there's time for some questions.
Thank you so much, Deborah. I think that was absolutely fascinating, so informative, such a lot to take in. So I'm really pleased that we're going to pop it up on our YouTube channel so people can revisit it if they want to. I think you did well to get through so much information in that time.
I was going as fast as I could, so there was time for questions.
Absolutely. So thank you. So I know you were going to look at the Q&A box yourself. Can you see the
Yes.
questions? I've got rid of some of the ones that were answered or just typos and things.
Yes, so I can see the question. So yes, anxiety around reactions is really, really common and it's really understandable. It's a horrible experience. It's a good idea to get some support. I know people feel a bit triggered when we talk about, getting mental health support. We're not suggesting that MCAS is in any way, a psychological condition or that your reactions are imaginary. Obviously not. But the emotional toll that it takes on people is really, it's massive. So please do get some support, see a counselor, a therapist, somebody who can work with trauma as well, around maybe memories that are affecting you of bad reactions. It's understandable to be anxious. Using self-help tools like breathing techniques and mindfulness and meditation have been game-changing for me. I use them a lot. I teach them to other people because they really do help, not as a cure, but as a way to cope with that anxiety. And, there are lots of tools that you can use to help you. We have a lot of resources about well-being on our website as well. We're doing a retreat, an online retreat on the 29th of November. So come along and get some relaxation and some, support in that. I've lost the questions. Where are they? Oh, I can't see that one anymore. I'll just go from the top. Okay. So the best way to approach skeptical doctors is difficult, and we suggest you don't go in all guns blazing saying, I think I've got MCAS, because that, causes them to probably not want to help. And a lot of allergy clinics won't accept a referral for MCAS, so try not to use the word MCAS. Even if your doctor agrees with you, tell them not to put MCAS in the referral letter, but list your symptoms, tell them you've got all these symptoms, you think you're struggling with allergies. You can take our leaflet in that we're for primary care practitioners, and that might help. But at the end of the day, focus on getting symptom control. So even if you can't get the label, the diagnosis of MCAS, if they will prescribe antihistamines, H1 and H2 blockers, mast cell stabilizers, ketotifen, sodium chromoglycate, those kind of drugs, they can prescribe those for allergy symptoms even without a diagnosis of MCAS, and they can help you. So try and talk to them about your symptoms and say you think they're allergy related, and could you possibly try some antihistamines, and maybe see if they might be open to finding out more. You can direct them to our website. We have a page, as I say, and lots of resources for healthcare professionals. And we're working on a GP pack as well at the moment, so there will be some information. So there is a support group. If you go to our website and go to events, you'll see every Thursday night, virtual sessions, I think it says in the top. Every Thursday night, there's a peer support group. So we get together and we talk to each other. And also, you can apply to be matched with a peer supporter one-to-one as well. There is a waiting list for that. We've got quite a lot of people, but you absolutely can. You're very welcome to join us on a Thursday night at 7 o'clock. We'd really welcome you to be there. And also our website, our Facebook group as well. We have a private Facebook group. If you search for, I'll find it and put the link in the chat. So it's yeah, there's loads of support available on our Facebook group. It's very well supported, and people do a lot of I'm
I
just
can
opening
pop
it
that
now
link
to put you.
into the follow-up email
Okay,
and we can put it on the
Marcel. Oh,
follow.
okay. Thank you. So, can a GP? So a GP can, it depends on the GP. I mean, some of them are confident to diagnose MCAS, some of them are not. But as I said, they can still prescribe you medications. So even if they're not comfortable to diagnose, so, they might be able to give you some of the medications like antihistamines just to see if they help you. Oh, it keeps jumping and I keep losing where I am with the questions. Here we go. Um, Sore tongue, stuffy nose after eating. It could well be, those are mast cell symptoms. If you avoid sourdough bread and cream cheese and you don't get them, then that there's your answer really. It's a reaction to those foods, and potentially it could be mast cell because they are both aged, sourdough and cream cheese, they're not fresh. So it's possible. On its own, it's difficult to say. You'd need other systemic symptoms in more than one body system. So do you also have itchy skin? Do you get, UTIs, things like that? Um, yeah, so exactly. Eating them together, your histamine levels are going to be higher than eating them individually. So that makes sense. Medications. R1 blocker. I'm not familiar with R1 blocker. I know H1 and H2 blockers. Um, I don't know what an R blocker would be. Sorry, I can't help you with that one. I'll have to look it up and see if I can find the answer. Um, so this is a unknown question, whether you're born with it or whether you develop it later. We think there is a genetic component because obviously it runs in families. Parents have it, their children have it. We can see siblings with it. So there's some kind of genetic predisposition, but a lot of people don't have any symptoms. It can be asymptomatic until you get COVID, until you catch Lyme disease, till you're exposed to mold. So it's sometimes that there's an environmental trigger that then kicks it off, but you may have been, genetically predisposed to it, but we don't know. Some people are born, poorly from the start, and other people develop it, but we don't know yet whether there's a genetic. But there is some research happening about that to look for the gene. General anesthetic, not dangerous. I wouldn't say it's dangerous. It's very individual. Lots of people with MCAS have general anesthetic and they're perfectly fine. It's important to discuss it with your practitioners, make them aware of MCAS, make them take precautionary measures. So you can use low adrenaline or no adrenaline as anesthetics. You can pre-medicate with antihistamines and mast cell stabilizers before operations. So you need to talk to your specialists and your anaesthetist. And anaesthetists are generally quite good at managing this and taking it on board. And again, we are publishing a resource about anesthetic and surgery. It's in the pipeline, it's being artworked now, so it's coming out with some advice about that. But generally, speak to your professionals, and if you need the surgery, you need the surgery. So it can be problematic, and people sometimes do feel worse after surgeries, but it's a calculated risk, isn't it? You have to kind of manage that as best you can. So I'm not medically qualified, so I can't recommend drugs, but there are lots of different H1 blockers available. And the thing is to do some trial and error because one might not help you, but another one might. They're all H1 blockers, but you might respond better to one over the other. That's what people generally find. So finding the right medication for you is a case of trial and error and trying different brands and trying different types. So things like fexofenadine, um, my brain's gone blank, cetirizine, loratadine. There's all sorts of different types of antihistamines, H1 blockers. And again, the same with H2 blockers. They are prescription only, but there's 3 different types currently available. So you have to just trial and error really. There's no this one is always a winner for people with MCAS. It's completely individual. Um, so it's not recognised in the UK by the NHS at the moment. Some doctors do recognise it, so it's not a blanket thing. And that is changing. My colleagues have just been to 2 different medical conferences and had people queuing up to speak to them, and doctors have all signed up to our mailing list and our network. So it is changing. People are becoming more aware of it. We're educating. Our Joy, our CEO, is doing education and training for lots of different NHS trusts. So awareness is growing. I know it's slow, but it is growing. And we are working behind the scenes. Joy has just announced that she's trying to, next year, her big project is to write some guidelines and hopefully get them accepted, adopted by NICE. That is a huge, huge project, which, there's no quick win there, but I promise you we are working on it. The trouble is you can't just change it like that because we need figures, we need research, we need statistics. And when nobody's even collecting the figures for how many people are being affected by MCAS because it's not diagnosed, there's no figures to say how prevalent it is. So NICE thinks it's a rare condition. We can't prove that it's not a rare condition because there are no figures. I can't tell you how many people in the UK have MCAS because nobody is recording that. So that's what makes it really, really challenging to get change at high levels. So, but we are working on it. I promise you, we are working on it behind the scenes, and we're doing it as much as we can, as fast as we can. Exercise intolerance, absolutely. A lot of people, not everyone, but a lot of people struggle with exercise. It is a trigger for mast cells in some people. So it's if you're getting flushing, I would say that's possibly, more mast cell related, indicating that there might be a mast cell component there. Again, it's common for people, not always, but sometimes. Um, yeah, this is the trouble. We do get immunologists generally don't recognize MCAS and they won't accept a diagnosis. But as I said, if you can get treatment, don't get hung up on the diagnosis. Don't let that block you. Work with them. If they're prepared to prescribe you antihistamines based on symptoms alone, then don't, let that stop you from getting the treatment because ultimately it's the treatment that you need. And a diagnosis can come later. As I said, if you email the charity info@mastcellaction.org, they will help you to find a mast cell aware specialist that you can go to instead. That's the best thing that I can suggest. So MCAS episodes, individual reactions are quick. They're over and they're done because the mast cell mediators go up and then they go down again. However, if you get into a state of hyperreactivity and you're in an environment where you're reacting to something all the time and something is triggering you all the time, then you will be stuck in that and it can be very long lasting. And so, yes, if you've done lots of work on your environment and your foods and you think there's nothing else I can cut, make sure that really is true. But also then think about if you might have any infections, because if you've got some bacterial or viral infection, if you just can't get stable no matter what you do, sometimes that's because there's a trigger inside and we need to treat an infection that can be a picture. But yes, mast cell, once you've been triggered into a flare, it can be long lasting. But the more you can be patient and stabilize and just keep working on your triggers, keeping your bucket as empty as possible, doing the relaxation and the nervous system work, because the nervous system triggers mast cells. If we're feeling anxious, that triggers mast cells. Anxiety, adrenaline, cortisol, they release, they trigger mast cells to degranulate. So we can get into a vicious cycle. So keep yourself calm through it, avoid your triggers, and you will come out of it. But sometimes they can last quite a while. I'm conscious that we probably need to go, don't we, Joe?
There's just 4 or 5 more questions. Maybe if you could
Is
just
there?
skim through. I think it just,
Are you
I
okay with
appreciate
that?
that we've gone over on time. Obviously,
I'm okay, but I just didn't know if you'd got to get onto another meeting. I'm happy
I've
to
got another
quickly
meeting at
whiz
quarter
through.
past two.
Okay,
But so if we can
I'll be
keep going,
quick.
just because obviously I'm really keen if you're happy to answer the questions people have obviously, I'd love for you to do that if you can.
Yeah, absolutely. And just reading this one. Um, So yes, if you've had a really bad anaphylaxis reaction, it's a good idea to talk to your GP about that, absolutely, and ask them whether they would recommend an EpiPen. Generally speaking, if someone has had anaphylaxis with MCAS, they should be prescribed an EpiPen. It can be quite tricky because of the difficulty in getting it recognized, but if you just describe it as, a severe allergic reaction, you don't need to get into the ins and outs of MCAS if you don't want to. I'd probably just advise you to just say you've had a really severe reaction and see, what he says to that. Um, and yeah, see if you can get a prescription for an EpiPen. Again, we're working on a resource about prescribing EpiPens for people with MCAS, and that will hopefully come out soon. But absolutely have that conversation, see if you can get an EpiPen. Um, Yes, a lot of allergy departments will absolutely refuse a referral. So again, in that case, don't fixate on the MCAS. Just get the treatment that you need for, if whatever they're prepared to give you support with. And again, email the charity info@mastcellaction.org and ask for the information to see if we can find somewhere else that it might be better for you to go. So supplements, our new nourishing health and happiness resource has a whole section on supplements. So vitamin C, vitamin D, omega-3 fatty acids, fiber, all really helpful. Quercetin sometimes is recommended as well. Again, people don't necessarily tolerate those. They're not a magic wand, but it's worth trying. Um, Numbness, yes, numbness down my left side is a MCAS reaction for me. Absolutely classic. As soon as I get that, I know I'm reacting to something. So vagus nerve stuff can be really helpful. I would say a nutritional therapist, but or a naturopath, as long as they know about MCAS. They're not all created equal. So make sure you get one that's gone loads of research and knowledge and experience of working with MCAS, because standard naturopathic and nutritional stuff won't help. Vagus nerve, yes, can be really helpful, but again, really, really slow and really, really gentle. Don't hook yourself up to a TENS machine and blast your vagus nerve with electricity. That's going to make things worse. Really low and really slow, really gentle with anything like that. Even just vagus nerve exercises like humming, singing, doing a low voo sound in your throat. There's lots of vagus nerve exercises. We've got a webinar on our YouTube channel about vagus nerve and the nervous system. So have a look at that. Um, oh, this is the R1 mast cell. What is an R1 mast cell blocker? I've not come across that before. Cocktail. Yes, exactly. It's a cocktail. People need multiple drugs to suppress, different types of different mediators. So it's important to get on the right drugs. 5 years. Oh, bless you. Well, you need to put your son in touch with us. Email info@marcelaction.org. Put him in touch with us, and he can join our medical professional network and get our updates. He can join our newsletter, and we're very happy. We're really wanting to work with medical professionals. So absolutely, he can volunteer with us, do some, stuff with us. Absolutely. Please get him involved. He can join our medical advisory board potentially. So yes, put him in touch with us. Yes, NG feeding, milk and soy based is problematic. Yeah, it is really problematic. There are often triggers in these tube feeding, artificial foods and things. It's just a case of trial and error, really, and trying to find the one that works for you. Yes, please do. Please email about your son. Yeah, I'm really sorry. I don't have a really clear answer about the tube feeding because it is problematic. There are quite a lot of ingredients in them that people can, react to, but it's trial and error. I hope that's helpful.
Deborah, thank you so, so much. I think that was really impressive to get through the amount you did in that time, and so lovely that I think we managed to answer all the questions.
Yes, I hope so. But I'm happy for people to email me if people want to ask. Deborah@marcelaction.org.
That's
Okay.
wonderful. Thank you so much. And we'll pop, when we send the email out to everybody with the link to the YouTube channel, we'll pop your email address and the contact information on there and the slide with the different things. And thank you so much for everyone for giving up your time to come and listen today. Please fill in the survey that will pop up when Zoom closes, and we'll share that with Mast Cell Action as well, just so that we can learn from how the webinars are going, what's helpful, what's not, and what we can do more of. So thank you to everyone, but most of all, thank you to you, Deborah. That was really interesting. Thank you.
Oh, you're welcome. Thank you so much for having me. It's been lovely. Thank you very
Take care.
much.
Have a good afternoon, everyone. Thank you.
Bye.